Welcome, and thank you for joining today to hear more about this initiative. As we get started, I want to introduce you to Virginia Nesbitt, who's our Employer Benefit Strategist, and I'm Danita Dubé, the Program Manager. The Dallas-Fort Worth Business Group on Health team would also like to thank you for your interest and participation today.
The Innovative Quality Healthcare Collaborative, or IQ Healthcare, was formed in 2016 to support the movement toward value-based healthcare and ensure employees receive high-quality, evidence-based, safe, and satisfactory care. We have chosen to partner with local healthcare systems and provider groups to accomplish this goal, building bridges to better outcomes. We believe when we do the right thing from a quality standpoint, the cost savings will follow. Employers want to pay for the right care, but don't want to pay for things that aren't adding value. Dr. Paul Hain, Market President at Blue Cross Blue Shield of Texas, is an executive sponsor of this project, and he reminds us that people should want and be provided with the minimum amount of care they can get that has benefit to them. More care than needed, such as over-imaging or over-medicating, adds costs and risks to the patient. As musculoskeletal conditions are a top spend for most employers, we're starting with uncomplicated low back pain. Our intent is to replicate to other conditions in the future.
So if you're directly responsible for benefits at your company, some of these stats will be no surprise to you. But these are some of the things we considered in moving forward with the initiative. The 5.8% growth over the next 10 years to 2025 will take us to 20% GDP. At that point, taxes would need to be increased, sizable cuts and other items would happen in defense and education in order to sustain that amount. From a 30% waste standpoint, we were surprised when we were meeting with the health plans and medical directors that they felt this really was a conservative number. From a standpoint of construction in the area, it's almost like a field of dreams. If you build it, they will come. And you probably are already keenly aware that the Dallas-Fort Worth marketplace is higher than the national average. You may not realize we're evidently in the top 5 in the country. And unfortunately, Texas has the highest uninsured rate in the country at 19%.
When we say burden here, we're referencing not only the economic burden on companies, but also the burden on people from a disability and well-being standpoint. Musculoskeletal conditions, especially low back pain, impact our quality of life. It is said that 8 out of 10 of us will suffer from low back pain at least once during our lifetime.
So from an opportunity standpoint and the emergence of IQ Healthcare, what's supply chain management as it relates to healthcare in North Texas? Today, many patients access a doctor or hospital based on the proximity to their home or their office. I know I have. When the reality is the selection of the right physician can have a material impact on the quality of care being received. We've been surprised in this initiative at the variation of care within each provider group and ultimately the opportunity to eliminate waste from the process. I expected each group to be different, but didn't realize the variation that there would be within each group. We'll show you a sample shortly. What do we mean when we talk about eliminating waste? I mean, just as some examples, non-evidence-based imaging, it could also be injections or surgery, wait times for appointments, multiple physical therapy appointments that aren't achieving results. Following evidence-based care, the physician or physical appointments really should only be minimal. This is another area where we've had such variation in the area of orthopedic surgeon. When patient self-refers, which we're being told is about 70% of the time, and they haven't really already been through an evidence-based screening process to ensure appropriate level of care. So we're not doing this in a vacuum. It's already something on a limited basis across the country, and in part indicating the employer's frustration with the process and system, and costs keep rising, but improved outcomes aren't necessarily in line with that. So just to give a few examples, in the Seattle area employers, you've heard us talk about this maybe before, Intel, Boeing, Costco, Starbucks banded together for an initiative. In Wisconsin, there have been employers such as Miller Electric Manufacturing. In Maine, Hannaford Brothers Grocery Chain, and also the state of Maine. These are several successful examples of employers working with healthcare suppliers, again, the health system, and providers, in essence, employer-driven healthcare.
So is it possible to create free market competition? We think so. We're bringing a Six Sigma mentality focused on evidence-based treatment guidelines so we can identify doctors and health systems that deliver higher quality care and promote them for their process improvements and results. Employers as purchasers can channel their employees to these suppliers, these physicians and hospital systems that are delivering the value-based health care. As healthcare suppliers embrace evidence-based medicine, the non-value added waste will be removed, which will lower costs for both the purchasers, employers, and the patients, our employees. What does it mean to leverage scale? We mentioned this in our opening slide. We've taken a collaborative approach and have worked to involve all the relevant stakeholders who aren't used to working together in this way. Purchasers haven't dialogued directly with suppliers in this market. As employers, we don't always realize the actual leverage we have with all the lives we cover in our plans. The employer challenges along the way we've realized that we haven't historically tried to leverage our collective scale to influence healthcare in our market. And at first, it's not a natural instinct. It's like learning to play a musical instrument. It's harder than it looks, and it does take practice. We promised you a sample of the variation in this marketplace. Using examples from a blinded study, you can see there is significant variance. There's not a medically based reason that the variance should be between $5,200 and $14,000 for essentially the same low back pain episode. A few examples explaining this variation that we've heard are it's challenging to maintain consistency in a broad network, or the more established physicians may be less flexible or innovative than the newer ones, the physicians that are newer to practicing. Physicians indicated that they may not have a choice if patients insist on imaging or surgery. The concern is that they'll lose business if they don't give the patient what he's asking for, or may bring charges of malpractice. We need to figure out how to monitor consistency and measure success, which is what IQ Healthcare is about.
So how do we do this? From a tactical standpoint, collaboration was one of the key things for us, and we met with providers interested in participating. 80% actually were interested, and we wound up deciding as we move forward with 4 that were ready to partner in discussing an updated process of care. Those include a physician network that's independent primary care physicians, an orthopedic specialty group, and 2 health system networks. We weren't really sure in the beginning that the providers would want to participate, and yet they've been eager to work with the employers. From a clinical care workstream standpoint, employers and providers meeting and discussing the current process of care for low back pain and looking for opportunities to bring a level of consistency with the right level of care to the right people at the right time. So we got together in these meetings over the last several months, and we reviewed and documented the current process of care. We worked together to make some modifications based on evidence-based treatment guidelines that would also help achieve a more consistent level of value-based care. Virginia, I'm going to ask you to comment in a moment, but I know from my perspective, the interactions between employers and provider participants was really an eye-opening experience, and it's been a great experience as well. We're pleased to be able to say that 2 of the groups are finished with the process. That's Catalyst Health and also Texas Back Institute. And the team's been really impressed with the openness and discussions around identifying ways to streamline and eliminate both waste and variation from the process. The remaining 2 groups are expected to complete the process documentation over the next few months. Virginia, what would you add?
So just from my perspective, benefit directors are not necessarily clinicians, and we're not trying to tell doctors how to practice medicine. Our approach has been to have the clinicians determine the evidence-based protocols that fit their treatment model the best.
Thank you. So on the data front, it's going to be critical and we need the baseline and then also measure results and continue to measure for sustained improvement. We're in the process of obtaining the de-identified market data from the health plans now. And lastly, an employer toolkit and resources will be one of the outputs. We're offering participating employers a toolkit of recommendations that can be used with any health plan, and also to the degree that's really a fit within your company and your culture. The toolkit will include things like sample communications for employees, but it'll also have C-suite communications that you can use with your leaders, some educational resources, plan design ideas, and a financial modeling tool just to help you evaluate the program potential effectiveness for you. Providers are considering this extra volume and the recognition, along with the opportunity to work directly with suppliers or, in essence, employers, a significant value, and they've been partnering with us even in the toolkit development.
So some of the key changes as a result of developing these clinical care work streams, the provider groups have created a formal vetting process for identifying providers outside of their scope, resulting in new partnerships. So when they need services for physical therapy, as an example, Texas Back Institute formed a relationship with Orosty as the first line of treatment with the same or next day appointments. They've also added a formal vetting process for physical therapy outside of their group as an example of the opportunity to achieve a higher quality of care for their patients with a much narrowed panel. Catalyst keeps the primary care physician at the center of care, with coordinators actively helping employees through the treatment process. But they've also established a partnership with the Methodist Health System when surgery is indicated as the appropriate level of treatment for a patient. Under enhanced patient education tools, the providers have created educational videos for the patients regarding acute uncomplicated low back pain. These come in the form of videos and podcasts, handout materials. The providers have also offered to provide on-site employer education classes and tools as appropriate. Some even have an Ask a Doctor program. Under care coordination, both provider groups that have completed have created a hotline and also a formalized screening process. The screening tool can help identify acute uncomplicated low back pain at the time of scheduling and therefore streamline the treatment process initiation. They've created a care coordinator position to follow the patients with acute uncomplicated back pain and have added a direct hotline and call center model so that employees can get faster answers to their questions and also understand the agreed upon process of care that they're going through. Usually patients are seen within 1 business day of the initial contact. The documented evidence-based process can now be measured. So with the help of supply chain management students from the University of Texas at Dallas, the providers have documented the process of care, and the data will be used to measure them against that process once we get the health plan data.
Thank you, Virginia. So the initiative is being sponsored by the Dallas-Fort Worth Business Group on Health. These are some of the members. As a reminder, the Dallas-Fort Worth Business Group on Health was founded over 30 years ago. It represents about 750,000 lives, employees, and dependents in North Texas, with an estimated collective spend of about $4 billion a year on health care just in this marketplace. So wrapping up, we do believe it's possible to make a difference in health care. We're engaging in the healthcare community in North Texas to optimize clinical performance for all the stakeholders in the community at large. We've started this initiative with low back pain, but we look forward to leveraging our collective scale later to influence the process of care with additional providers as they see the impact, and also expanding to other coalitions around the country in the future. We're going to focus on the evidence-based care. We believe that gathering the data and finding out what treatment strategies work best for people and then driving the highest quality and patient safety are the most cost-effective, and things that are the most cost-effective, we can make a lasting difference, and that's our goal. We'll continue to update the IQ Healthcare tab on the www.dfwbgh.org website, so you can watch for more information. And if you're interested in participating or just want to talk with us further, please contact us at the email on your screen. Thank you again for listening in today. We hope to hear from you soon.